There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question: if I were to take one blood pressure medication, which would it be? Answer by Randy Shaver. That is a decision that you doctors should be making, not a bunch of people on the internet. There is a reason that it is a doctor's decision. He or she worked hard to achieve the degree they have. They have such a large range of training that allows them to be able to access your entire medical condition, which can determine which medication you can or should be taking. There are many variables which cannot be determined here. How high is the blood pressure? What are possible causes for high blood pressure? They need to know things such as your weight, height, some idea of your diet, family history of any cardiovascular conditions, sex, activity level, etc., etc., etc. Do not use the internet for medical advice of this nature. Do not use commercials on television for your medical advice either. When you go into a doctor and say maybe I should be on this medication, you are not being a good patient if the basis is that you saw a bunch of happy people on the television taking the med. Now, if the reason you make a suggestion like this is based on your current medication is not doing what it is supposed to do and you want to consider alternatives, then you're a much better patient. The current commercials for many medications are no better than cigarette commercials on the 1960s. The drug manufacturers are just interested in making money without considering whether someone needs the drug in question. Answer by Yolanda Grady. With all due respect, you must see a doctor. Cora is not a hospital. I admit we do have some actual doctors and nurses here, but none of them have met you and examined you. And they also don't know about your medical history. You cannot ask a bunch of strangers about something as serious as what prescription is best for your body. Someone online, even if they mean well, can tell you the wrong medication, which in turn could make you very sick or even kill you if you have a bad enough reaction. See a doctor in person who can examine you fully. Please. Answer by Pranay Yao. Any blood pressure medicine is good as long as it lowers the blood pressure. But certain diseases require specific ones. Diabetes, angiotensin receptor blockers or ACE inhibitors. Migraine, probably try beta blockers. Systolic hypertension, calcium channel blockers. Postmyocardial infarctionase inhibitors and beta blockers. There are certain conditions where a few cannot be used. From personal experience, I saw a lot of hyponatremia in patients using hydrochlorothiazide in the hot summers of South India. So wouldn't use it as first line in a patient living in hot and humid weather. Beta blockers are contraindicated in severe peripheral vascular disease, rest pain, ulcers, etc., and severe COPD and asthma.